Everyone, welcome back to my YouTube channel. Friend, today we are going to discuss very interesting topic that what is a CPR. We will cover these topic that what is the CPR, purpose, indication of the CPR, steps of CPR and possible complication. Please watch the video till the end, then only you will be able to understand. I have created this video with the help of notes. You will understand it properly. So without delaying anymore, friend, if you have not subscribed my channel, please hit on the subscribe button. You will get the video related to the biological stuff in my channel. So friends, if you are also new, then also hit on the subscribe button. Now let's move further. This is the introduction of the CPR. So what exactly is the CPR? Cardiopulmonary resuscitation is the full form of the CPR. As its name suggests, let's have a look at the definition first. This is a life-saving technique useful in the heart attack, respiratory arrest, in which the someone breathing has stopped. Suppose that if a person has got a heart attack or the respiratory arrest, then what happens? Our heart gets stopped pumping or our respiratory system stopped the breathing. This is a very critical position that our heart stops pumping or the respiratory system has stopped working. So this CPR is a life-saving technique in which our heart get work properly. Okay. So how does this CPR work? When we perform the CPR, then in this video you can see the person is performing the CPR. So our brain starts getting oxygen. How it starts getting oxygen? Because we put the pressure on our heart. While pushing the pressure, our heart is able to pump the blood in whole the body. So our brain is also getting the oxygen properly. So this CPR is not a permanent solution for the heart attack or respiratory arrest. Basically, this is a life-saving technique until the medical treatment can restore the normal heartbeat or ventilation action. Now let's move further that what is the purpose of CPR. You just learn this purpose of CPR by ABC. A means to maintain the open and clear airway. Means our what exactly the CPR does? It maintains and clear our airway. And it maintains the breathing by external ventilation. We give breath to the patient who has got the breathing stopped. And third purpose of the CPR is to maintain the blood circulation by the cardiac massage. Our heart starts pumping the blood to whole body. How does it perform? When we perform the external cardiac massage. So only these are the three purposes that CPR maintain our airway, and third, we give the external breath to the patient. In this way, its breathing starts getting normal. And third purpose is that our heart starts circulation properly by the external cardiac massage. We will see further step by step that how this purpose is affecting, how this purpose is useful in our CPR process. So the technique is to learn the purpose of CPR is the ABC. A means airway, maintain breathing. C means maintain the blood circulation. Now let's see the indication of cardiac arrest. You know very well this basically when we have to perform the CPR in the two cases. When the person suffer from the cardiac arrest or the respiratory arrest, then we need to perform the cardiopulmonary resuscitation process, CPR. So first question arises that what are the indications of the cardiac arrest? We know cardiac arrest is a common cause of the CPR, basically common cause in which we have to perform the CPR. So indication of the cardiac arrest, that these are mentioned below. That ventricular fibrillation is the first reason of the cardiac arrest. We are going to see in this slide that how the cardiac arrest problem arises in the patient. So first is the ventricular fibrillation. What is ventricular fibrillation? It means that when our heart starts pumping very fastly and in the abnormal way. In the abnormal way, when our heart starts getting pumping very fastly in the abnormal way. In this video, you can see our normal heartbeat is 60 to 100, 60 to 80 beat per minute. But in the ventricular fibrillation, our heart starts beating more than 250 beat per minute and in the irregular way. Not in a proper way, in the irregular way, abnormal way, our heart starts getting pumping more than 250 beat per minute. So this is known as a ventricular fibrillation. And this ventricular fibrillation is the cause of the cardiac arrest. I hope that it is clear what is ventricular fibrillation. Next is the ventricular tachycardia. As its name suggests, tachycardia. Tachy means fastly, cardia means heart. When our ventricles starts pumping very fastly, this is known as the ventricular tachycardia. So ventricular tachycardia is the second reason of the cardiac arrest. Let us see the difference between ventricular fibrillation and ventricular tachycardia. So friends, there is a minor difference between the ventricular fibrillation and ventricular tachycardia. Please have a look at this graph. This upper graph is the ventricular tachycardia and this lower graph is the ventricular fibrillation. Please avoid this middle graph, ventricular flutter. Okay. So in the ventricular tachycardia, what is happening? Our heart is beating very fastly but in the orderly manner. It is in the order manner. In the order manner, it is pumping very fastly. So this is the ventricular tachycardia. If I look at the ventricular fibrillation, in the ventricular tachycardia, I have told our ventricles starts beating very fastly in the order manner. Look, the graph is equal. It is fast. It is beating fastly, but in the proper order manner. In the ventricular fibrillation, what is happening? Our heart is also beating very fastly, but there is no proper order. There is no proper manner. Okay. So this is a major difference. This is a major difference that in the ventricular tachycardia, heart is pumping in the order manner. In the ventricular fibrillation, heart is pumping in the abnormal way. In the abnormal way, it is pumping. I hope this is clear now, the difference between the ventricular fibrillation and the ventricular tachycardia. Now let us move to the third point, asystole. Asystole is also a cause of the cardiac arrest. What is asystole? Asystole is nothing, it's just the absence of any sort of heartbeat at all in the ventricle. When sometimes friends it happens that our heartbeat, any sort of the heartbeat stop at all in the ventricle, then this is known as the asystole problem. So asystole is generally what is happened in the asystole, that any sort of the heartbeat stop in our ventricular chamber. Now let us move to the indication of the respiratory arrest. So as I told friend, when the person suffers from the cardiac arrest and the respiratory arrest, then we need to perform the CPR. So we have already discussed the cause, the indication of the cardiac arrest in the previous slide. And in this slide, we are going to discuss the indication of the respiratory arrest. So first is the drowning. Drowning is not drowning like when the person is stuck in the when the person doesn't know the swimming and he gets stuck in the water. So this condition is known as a drowning. Then the water fills in our nose, water fills in our basically trachea. Then the person breathing gets stopped, gets stuck due to this drowning. Second cause is the stroke. Stroke is a medical condition in which poor blood flow to the brain result in the cell death. What is a stroke? This is a kind of medical condition in which our brain doesn't get the proper blood circulation. Due to this, our brain cells starts getting dead. So stroke is a medical condition in which our blood flow stops properly, in which our brain doesn't get the blood flow properly. Okay, now we are going to discuss the third point, that is the foreign body in the throat. When any foreign body It could be either the coin, it could be any metallic part, or anything comes in the foreign body get stuck in our throat, then the person breathing gets stopped. He is unable to breathe properly. So this is the next cause of the respiratory arrest. Similarly, smoke inhalation. If a person is a smoker or he is unable to bear the smoking smell, then smoke inhalation is a reason. Drug overdose, suffocation, accident, injury, coma, and epiglottis paralysis. What is the epiglottis paralysis? So, the nerve impulses to your voice box larynx are ruptured, resulting in the paralysis of the muscle. So, this is a medical condition in which the nerve impulse of our larynx, of our voice box, are ruptured. When our nerve impulses of the larynx are ruptured, then it causes the paralysis of the muscles of our epiglottis. So I hope friends these are the indication you can see in the diagram. This is a like one-sided paralysis. This is the next slide, that is steps of the CPR. Now we have seen the indication. Now we are going to discuss step of the CPR. There are 5 to 7 steps that approach the safety, check the responses, call 911 ambulance. We will see these points step by step in the further video with the help of example, with the help of note. So first point is to approach the safety. What is approach the safety? It means that if you find any person lying down on the floor and he is unconscious, then our first step is the approach the safety. Approach the safety means first we should take care of ourselves. In this video you can see this girl is first observing here and there that whether the person has fallen due to which reason, like maybe it has fallen due to any other reason, like due to summer season. Okay, so first is to check the safety, second is the check the responses. If you are sure that we are also safe in the region, then our second step is the check the responses. How we will check the response of the patient? We have to shake the shoulders gently, ask, are you alright? So we have to shake the shoulder of the patient and we have to ask very gently that are you alright? Okay. So the second point is if we respond, if while shaking, if we respond yes I'm okay, or if he is shaking his head, then we have to leave him as you find him. Means no need to perform the CPR. Only if he responds, then we can have a normal conversation with that person. Find what is wrong. If he responds, then ask him that what is wrong, why you have fallen down, due to any summer reason, or what is the problem. If he doesn't respond anything, then we have to take the next step. So I will show you the video that how we have to check the response of the patient. As I told, look, in this video, this lady is shaking on the shoulder. If he is not responding, then we have to follow the further step. I hope friend this is the second step, check the responses is clear. So now the third step is the call 911 or ambulance. If the candidate is not responding at all, then we have to follow the third step, that call the ambulance. If anybody is there, then you ask them to call, otherwise you will have to call to the ambulance. So the fourth step is the until unless what we have to do, we have to be prepared for the further step. So the fourth step is the open the airway. How we should open the airway of the patient? Lay the rescue air and head tilt and chin lift. First we have to lie down the patient in the correct position. Okay, how we should open the airway? We should put our two fingers at the bottom of the chin of the patient and our second hand should be on the head of the patient. So we have to bow down his head and side by side we have to lift the chin of the patient very gently, not so hardly, very gently. Okay, I will show you the video. You will come to know that how we have to open the airway of the patient. Why we are doing this activity? First, let's see what is happening. That we just lift the chin of the patient by putting his head on the downward side. Then what will happen, friends? In this video you are going to see that if anything is stuck in the airway, then we will be able to see. Here in the note it is mentioned, no need for finger sweep unless solid material can be seen in the airway. We are performing this step because we want to check that if anything is stuck in the airway or not. So friend, we need not to put the finger in the airway. Okay. Here it is clearly mentioned, no need for finger sweep unless solid material is found. Okay. So next step is the check the breathing. So we have followed the 4 steps successfully. Next step is the check the breathing properly. There is a step I have mentioned that we have to follow the LLF. LLF is for the normal breathing. So by LLF, what is the meaning of LLF? First L means open the mouth and look at the chest. So we have to open the mouth and look at the chest side. Why we have to look at the chest? That whether the chest is rising or not, the person is breathing or not. Okay. Second step is the listen the breathing. So we have to listen the breathing of candidate. How we should listen? How we can listen the breathing? By putting our head in this position, that our ear should be in front of the nose of the patient. Okay. Then we have to feel the breathe on cheek. So friends, this is a very easy step that we have to follow the LLF. L means we have to look on the chest. We have to look on the chest whether the chest is rising or not. And second L means listen the breathing. We have to put our mouth in this position, that ear should be in front of the nose of patient, and we should feel the breathe on cheek. You can see in this video, this person is putting his ear in front of the nose to listen the breathing and to feel the breath given. If the person is breathing, so that the person can feel the breathe on his cheek. Okay. So in this position, we have to check the breathing of the patient. If the patient is not breathing at all, then we have to follow the next step of the CPR. I hope friend this is clear that how we should check the breathing of the patient by following the LLF. Okay. So friends, let's move to the further step. Before that, I just want to tell you that if you are facing any issue, you can mention in the comment box that if you have any kind of doubt, I will clear it out, friend. So friends, also don't forget to subscribe my channel. So let's move to the further, that by following this checking the breathing step. If you have checked that patient is not breathing at all, if the patient is breathing, so we have to stop. If the patient is not breathing, then we have to go for the chest compression. Before that, friend, we also please check the pulse of the candidate by putting the finger on the wrist. If the breathing is not happening, if the pulse is not pumping at all, then we have to go for the chest compression, CPR. Okay. So first is the chest compression. We have to give the chest compression by following these 9 to 10 points. So first is the give the 30 chest compression. We have to give 30 chest compression. So friends, we have to follow this step. If the person is not breathing at all, if the heart is not pumping, airway is not, that if the person is not able to basically breathe properly, then we have to move on this step, the chest compression. So we have to give the 30 chest compression. How we will give the 30 chest compression? That first we need to give the 30 chest compression by following these points. Place the heel of one hand in the center of the chest. First we should make our position in this way, we should place the heel of one hand. We should place the heel of our one hand in the center of the chest. And second is the place other hand on the top. I will show you the video properly. That first we'll look at the point mentioned in this slide. First we have to place the heel of our one hand in the center of the chest. Second is place other hand on the top. Third is interlock the finger properly. then compress the chest, and compressing the chest there is a rate. So we have to follow the 100 rate per minute. Means we have to give the compression 100 compression per minute. Okay. Then if I talk about the depth side, so depth should be 4 to 5 centimeter. We should also be careful. You can look in this video, friend, that how this person is giving the chest compression. He has put the heel of one hand and interlock the finger. Chest compression he has started. Rate is the 100 per minute and depth is 4 to 5 centimeter. Equal compression is equal to relaxation. Means the depth ratio should be like that. That the ratio of the compression should be equal to the ratio of relaxation. Means whatever depth we are preferring to give while to give the chest compression, so the relaxation should also be the same. Now the last point is, when possible, change the CPR operator every 2 minutes. Sometimes what happens, friend, if the person who is giving the CPR is getting the is facing the issue, is not able to perform the CPR due to anyhow reason, then the CPR operator can also be changed after every 2 minutes. So at least for a 2 minute the person should give the chest compression. Okay. So there is also a possibility that we can change the CPR operator in after every 2 minutes. If I talk about the friend note side, in the note also I have mentioned that take care of the depth. While compressing the chest, it should not be too deep. Friend, while giving the chest compression, we have to be very careful about the depth part. As I told, the ratio, compression ratio, relaxation ratio should be equal. It should not be too much hard. Otherwise, injury, there are chances of the injury. Friends, there are a lot of complications of the CPR also we have if we don't perform it properly. So you are requested, if you are not expertise in the CPR, then don't try immediately on any patient if you find on the road or anywhere. First you should do practice on the dummy either in the school or in anywhere. First we should be expertise, because it's a matter of life saving of other person. So friend, next step is the rescue breath. After giving the 30 chest compression, we have to give the 2 rescue breath. Whether we are performing the CPR for 1 minute or either 2 minutes, but after every 30 chest compression, we have to give the 2 rescue breath. For giving the rescue breath, there are many ways. Some person give the breath by mouth to mouth, or nowadays medical devices are also available to rescue the breath to the patient. These are the steps I have mentioned in this slide, that how we can rescue the breath to the patient. So first is I will also show you the video. So first have a look at the step. We have to open the airway of the patient. Then we have to place one hand on the chin, one on the forehead. Okay. First have a look at the video. This person, what is he doing? He has placed one hand on chin and one on the forehead. Okay. Then tilt the head back, slightly lift the chin. Then make sure airway is clear. So this person is rescue the breath by mouth to mouth. So tilt the head back, slightly lift the chin. Then make sure airway is clear. Then we have to pinch the nose and cover the mouth with yours, or you can use the medical devices as well to give the breath to the patient. Then we have to blow until the chest rises. We have to blow with our breath until the chest rises. So how we should give? To give one breath for 1 second. There is a duration to rescue the breath. Like give the one breath for 1 second. So this person first what has done? He has pinched the nose of the patient and covering his mouth from the patient mouth. The duration of rescuing breath is that give one breath for 1 second, give second breath for another 1 second. Okay, like the duration should not be more than that actually. So we should be take care while giving the rescue breath as well. We have to blow until the chest rises. I hope friend this slide is also clear. Now let us move to the next, that rescue the breathing instruction. There are some instructions for rescue breathing. As soon as you see chest movement, stop the rescue breathing. If you see that yes, the chest has started moving upward side or downward side, then we should stop the rescue breathing. So our one eye should be on the chest of the patient. Okay. No, the second point is that be careful not to give too much air. If we give too much air to the patient, then it may also arise a problem. There are chances for the injury as well. So in the CPR, we have to follow these instructions properly. If you see the chest compression, chest is moving, then we should stop the rescue breath and we should be careful. I hope friend this slide is also clear related to the instructions of the rescue breathing. This is a good step. Now let's move to the possible complication which may happen due to the CPR. So friends, if we are performing the CPR, we should be expertise. First we should try on the dummy to become the expertise because it is a matter of life of the another person. We should not play with life of anyone. Okay, so these are the possible complication I have mentioned here. First is the coronary vessels injury. Some coronary vessels are there in our heart. So these coronary vessels may get injured if we are not performing the CPR properly. So diaphragm injury is also there if we are pressing the basically heart. So there are chances of the diaphragm injury. Hemothorax may happen, pneumocardium may happen, liver injury is also another complication. Next is the myocardial injury. Myocardial is the middle layer of the heart. So there are possibility for the injury may happen in the myocardial of the heart. Next is the pneumothorax. And last is the rib fracture. Chances of the rib fracture as well, rib bones fracture. Spleen injury. Spleen is also an organ which is located in our near to our heart. So spleen injury may happen, and sternum fracture. Sternum, this is the bone between the chest. So there are chances for the sternum fracture as well. So friend, 9 to 10 complications are there. So please be careful while giving the chest compression, while giving the CPR. I hope friend this video is very much clear to you. So thank you so much for watching this video. If you like this video, please hit on the subscribe button. So thank you so much friends. Have a good day. Don't forget to subscribe my channel. Okay friends, thank you.